आने वाले कल की दस्तक हमें सुनाई देती है। नई मंजिल है जिस ओर हमें वो दिशा दिखाई देती है। नए इंडिया का नया जोश, नए इंडिया का नया जोश, नए जोश से निकल पड़े हम, आने वाला कल होगा हमारा। नए इंडिया का नया जोश।
और नए इंडिया के सफर में टेक्नोलॉजी की शक्ति लेकर आपका भागीदार रहेगा रिलायंस। नए इंडिया का नया जोश।
आने वाले कल की दस्तक हमें सुनाई देती है। नई मंजिल है जिस ओर हमें वो दिशा दिखाई देती है। नए इंडिया का नया जोश, नए इंडिया का नया जोश, नए जोश से निकल पड़े हम, आने वाला कल होगा हमारा। नए इंडिया का नया जोश।
और नए इंडिया के सफर में टेक्नोलॉजी की शक्ति लेकर आपका भागीदार रहेगा रिलायंस। नए इंडिया का नया जोश।
Sorry. Okay, will do. Thank you.
Hi Puneet.
Hi, Deepak.
Hi Puneet, hi Deepak, how are you both?
Hi Suman, how are you?
All
Good to see you.
Good to see you too. How are you doing?
Very good, very good.
Still working from home, Suman?
Yeah, up until September.
Okay, lovely.
Ladies and gentlemen, and a very warm welcome to the third day of jointly organized by the Division of the Ministry of External Affairs. This session I'd like to invite Mr. CI National Committee of Tourism and
Renuka, there's a lot of disturbance and we can't hear you.
session CI National Committee on CEO being in context and take Well, you're muted. Can we start with the session? Yeah.
Let me interfere here. Good afternoon, Suman. Can you hear me? Okay, Deepak, you can. So maybe I start. Miss Singh, if you can hear me also, then it's good. I'll do the introduction. There is some problem with the technical part. If I may request, if you're not speaking, everyone to go on mute. Okay, now this is good. There's no disturbance. Good afternoon, everyone. I'm Puneet Chatwal, Chairman, CII, National Committee on Tourism and Hospitality, as well as I'm the MD and CEO of Indian Hotels, popularly known as the Taj Group. I'm extremely honored to welcome a very distinguished panelists today for the discussion on a policy dialogue on revival of the tourism industry. We have with us today Mr. Suman Billa. He needs no introduction, but for the sake of good order, Director of Technical Cooperation and Silk Road with UNWTO, Mr. Deepak Deva, MD Travel Corporation of India Limited and MD Sita India. Special guest, Ms. Maribel Rodriguez, Acting CEO, World Travel and Tourism Council. Mrs. Inda, Head of Marketing Division, Bali Government Tourism Office. Mr. Vachirachai Siri Sumpum, Director Tourism Authority of Thailand. Mr. Nabil Sultan, Divisional Senior Vice President, Emirates Sky Cargo. And we were also to have Ms. Rupinder Barar, Additional DG Ministry of Tourism. I don't see her at the moment on the panel, but hopefully she will join soon. So, welcome everyone. Some little introduction from my side before we start an interactive panel discussion with our esteemed panelists. I think tourism globally and in India has always played an important role in contribution towards the GDP and in contribution towards the employment. We have more structured figures available for the globe because the contribution pre-COVID has been more than 10% for GDP and also in terms of jobs. But in India, we have to look at it together as organized and unorganized sector. If we do that, that figure also goes into the double digit. And since COVID has hit, this sector has been almost paralyzed. Some call it demolished, some call it it's been on a ventilator. And the contribution is consistently going down because international travel is shut. The foreign exchange receipts on tourism are coming down to almost nil. And also within the states, the travel in India has not been easy with every state having different regulations. Thank you. We see that Ms. Rupinder Barar has also joined. Thank you for joining. Some of the encouraging news has been coming of late, and that is the confidence in travel, albeit at a low level, is beginning to rise because of the boost in vaccination drive. And what we need at this point of time is certain policy priorities which include not only restoring confidence, but having some form of travel protocol, some form of incentives to generate at least domestic tourism or to encourage domestic tourism, providing very clear guidelines on do's and don'ts, which go beyond states and are applicable to all, and ideally it's across the globe and with various countries, so that the cooperation amongst the countries is strengthened, so we can build more sustainable and more resilient tourism, and also are allowing foreign tourists who are fully vaccinated to travel freely. Many countries have done so, and others are following. I think this is where we need to have discussions in terms of having our own experiences with best practices that we are all aware of, because you all happen to be leaders in your regions or in the jobs that you are in, and what can be done. With that, I would like to invite, maybe we start with Ms. Maribel Rodriguez from the World Travel and Tourism Council, and followed by Mr. Bila, and then the rest I will call to give some kind of opening inputs and remarks to the policy dialogue on revival in the tourism industry. Over to you, Ms. Rodriguez.
Thank you. Thank you very much. Good afternoon, good evening for you. Now I'm based in Europe. It's early morning. Thank you very much for inviting me. And thanks to Mr. Puneet Chatwal, Chairman of National Committee of Tourism and Hospitality and Managing Director and CEO of the Indian Hotel Company and fellow member of WTTC. Of course, thank you very much for inviting. Before I start, just a quick note telling who we are. We are a membership organization. We represent over 200 CEOs at a global level that represent every different sector and industry and geography, 30% Asia, 30% Europe, and 30% America. So we have the global picture of what are the policies and what are the things that the private sector has to do when it comes to talk to governments. Our work is, we do a lot of research. We do research for the economic, and we analyze the economic impact that the travel and tourism has in the economies of more than 185 countries. Unfortunately, now, as you all see, as Puneet was mentioning, we were before the COVID, 10.4% of the global GDP was because of travel and tourism. And after the pandemic, we are now 5.5, which is a 49% of decrease. Before the pandemic started, 1 out of 10 jobs were created because of travel and tourism, and 1 of 4 new jobs created was because of travel and tourism. That really means an important engine for the economy, for the social impact, because and the employment. When it comes to the Asia-Pacific region, it has been really hit, probably one of the most heated all around the globe. And the reason is because it was growing more than the rest. Before the pandemic started, the tourism was growing year over year 3.8%, and the region was growing by 7%. Of course, now the impact has been very important, and of course has been affecting the employment. India, before COVID, the 6.9% was related to travel and tourism. Now 4.7% is because is the impact on the economy. And what we can take, all the takeaways that we are seeing now after the waves that hit us in all the world, is that we need to work together. If we look at the economic impact timeline that different crises has left us in the past, September 11, the economic crisis, the September 11 one, we took a lot of time to recover. Why? Because we didn't collaborate, the private sector and the public sector. The decisions were taken without being asked. What happened in the financial crisis, the head of states were meeting the Minister of Finance. So the recovery was in V-shape. What is happening right now, if we want to recover faster, we need to be organized. We need to be working together. It's very important. We cannot do this alone. It's impossible, okay? So we need to have an international coordinated approach that includes this private and public sector collaboration to establish an international mobility framework that is going to be allowing us to have safe movements of people by removing restrictions. Of course, now what we have to do is first focus on the sanitary and epidemiology conditions, but now that the vaccination rolling out is going and improving all around the globe, for example, in Europe as an example, now, not before. Before we were not coordinated, but now this coordination, this health pass that is going to be used now for the Europeans to travel, to move from A to B, this is really important, and we have to use that all around the globe. And before we start to create new rules, before we start to create new passport, new things, why don't we just copy what others are doing good? Because Europe, before now, we were doing really bad. We didn't talk each other. We were not coordinated. Different countries, different approach. But now, by having this approach and already this platform, I would encourage that the other countries are doing the same. And of course, we are not going to be forgetting about what we have been, all the protocols that we have been implementing. We have to keep using some of those protocols and some of those conditions to travel. Masks probably will stay, because what happened before in the September 11, we incorporated the security component. Now we have to incorporate the sanitary component, and probably we will keep it forever. Probably we will ease some of those new things that are coming to us, but not yet, because we have to learn to keep and survive and to work and to have our economy up and running with COVID, because otherwise you have seen the figures. We are gonna be losing jobs, we are gonna be losing employment and all the impact in the economy. So we continue, of course, the support to the sector. We have been calling governments to support the private sector, financial support, fiscal support, worker protection. And it's the only way that we are gonna be surviving as an industry. There is a path to recovery. We have to use the technology. We have to think about how sustainable we are, because the new consumer is going to be more responsible. And not that everybody is in this standby, but starting to move already. You need to be competitive. Every country needs to be competitive. And we need to think about who are our markets that we want to reach? What is our consumer? What do they want? What do they like? And target them. We don't have to concentrate and put, for example, now in Europe, Spain, where I'm based now, for example, we were always working with the UK. UK is not traveling, there is a big gap. No, we don't have to have gaps. We need to concentrate to diversify our product, to diversify as well our markets, and be able to tackle all those things. Like that is the only way to be competitive. Coordination between countries is something we like to highlight in regions. Use the past, use the learnings from the past, and of course, keep and promoting events and traveling. We did our first event in person in Cancun, health and safety protocols implemented. We created a bubble, and now we are gonna be doing another event in Manila, in Philippines, at the end of the year. I hope that by then we can all travel, that the vaccination rolling out is better, that the measures are still in place, and we can all travel safe, because that's the most important thing. But we cannot forget about how important is our industry and our sector when it comes to social impact and job employment. So thank you very much. I stop here. I'm happy to take any questions later.
Thank you, Maribel. Thank you so much. Mr. Suman Bila, if you would like to add on to the comments made before we come to the real India situation and then to the region. Could you unmute yourself, please?
Thank you, Puneet. Am I audible now?
Yes, yes.
Okay, excellent. So let me just add on to the comments that Maribel has made, which are very pertinent. I will, since there are several people who will speak from the India perspective and from the perspective of several nations there and the industry perspective, let me try and give you an overview of how the global situation is looking, and possibly a few suggestions as to what the Indo-Pacific countries can do by way of collective action. So as you know, the United Nations World Tourism Organization has been working closely with the World Health Organization since the onset of the pandemic. And we have regular consultations with them. And from what we see, I think today we stand on the cusp of a very big change, because we are literally waiting to see as to which way the ball is going to roll. As all of us know, most of the developed nations have undertaken massive vaccination campaigns, and they have achieved a critical mass which is very close to hitting herd immunity levels. Leaders among them have been, the US has done extremely well, the EU countries have done well. There are some countries like Israel which have done very well, which have taken a very aggressive position on vaccination. and Singapore. So we have very good examples of countries where a very good critical mass of vaccination has already been achieved. One of the things that we also see a trend over the past few months is that we also see that there have been several mutations of the virus and which have emerged into variants of concern across the world. And the most prominent has probably been the Delta variant, which has affected India, which triggered the second wave. And it continues to move across the world, because by this time we know that if there is a variant anywhere, it is only a matter of time before it reaches out elsewhere. So today, one of the challenges that Europe faces, and in UK especially, there are several Delta variant cases which are already there. In Portugal, we find that the Delta variant is the predominant variant, and the cases are rising both in Spain and Portugal. But I think the country which has the most number of cases right now is the UK. So essentially what is happening here is that in the UK, we have a country where vaccination levels have been extremely high. And we also have a situation where the variant of concern has also reached. So essentially it is something like a face-off where everybody is waiting with bated breath to see as to which way it will go. So I think in about a month's time, we should be fairly clear about what conclusions to draw and what our plan of action should be. So to my mind, I think the most likely outcome is probably going to be along these three lines. The first is probably that vaccination is effective and it stops the contagion, in which case we all go back to life as it was before, and everything is good. The second situation is that vaccination reduces hospitalization and mortality, but you would still have to face the problem of having the contagion around. And the third is, of course, is the worst case scenario, is that the vaccine has a limited bandwidth of effectiveness, which means that we are back to the drawing board on where we were about a year ago on how to handle the pandemic. But I think the most likely scenario that we are likely to see is the second scenario, in which we will find that the vaccine is effective. It is effective in reducing hospitalization and morbidity, but the infection itself will probably stay in a milder form and people would still be susceptible, as we are seeing now. So, which means that we are likely to go into a situation which a policy that Singapore has unveiled a few days ago, where they have said that we need to live with the new normal. They have said that, look, the COVID is not going to go away. It is going to be there, but with vaccination, we can reduce the fatalities and the casualties that we have, but we will need to make a provision for it being there and therefore take all the precautions. And as Maribel said, we need to kick in a new set of protocols, just like what we did after the 9/11 things. We would perhaps need to draw up a new protocol for the new COVID normal. Now, what this also means is that we would also have to upgrade the vaccines regularly, and that would also need to be administered to people from a time to time on a timely basis for us to be able to keep the mutations at bay. But I think the most important question that it raises is about vaccine equity, because today we see that a lot of developed countries have actually raced ahead and achieved excellent levels of vaccination, but there are a lot of countries, especially in the South, who have not been able to achieve vaccination, and the availability of vaccine is still a challenge because several of them are still dependent upon the WHO's COVAX program. So the vaccine equity is going to be an issue. And I think what it is going to trigger, and perhaps the most important dimension for us to look into, is that this is probably going to trigger a new wave of inequality, because countries who have been vaccinated will probably get a big head start over those who have not been vaccinated, in that their economic activities will be kick-started as of today, whereas several others may have to wait for a little bit longer for them to take it off. In fact, if you look at Israel's reasoning for taking up the aggressive vaccination campaign, they have said that the most important consideration for them was that the cost of the vaccine is far lower than the loss in productivity because of lockdowns and waiting for COVID to play itself out. So I think that is an issue that we would have. So therefore, I think the question that we need to look is, how should tourism respond in the current circumstances, and especially from an Indo-Pacific perspective. I think there are two kind of interventions that are there. There are interventions that can be and that ought to be made individually. That is, every country decides for itself as to what it is that is to be done. But there are also interventions which need to be made collectively. And Maribel has spoken about coordination as being the key. And I think there are certain set of things that need to be taken only within collective frameworks. So if we look at those which are individual, those are the regular ones, and I'm sure several of our colleagues will speak about them, which is about encouraging job retention, supporting liquidity for the industry, reviewing of taxes, capacity enhancement, providing incentives, all of those. But the ideas that I really want to speak about, especially from an Indo-Pacific perspective, are three ideas. And these are elements that can only be taken up in a collective framework. The first is travel groupings, and Maribel has mentioned the case of EU. And about a year ago, when the UNWTO started talking about the vaccine passports, we thought that the best case scenario would be when you have your vaccination shot, you're vaccinated and you're clear, you will be able to travel wherever you like in the world. But it doesn't look like that is the way it's going to play out to be, because it's happening on travel groupings. One prime example is the EU, where basis the level of vaccination and basis the level of containment of the virus in each of the countries, they are now creating a framework within which people will be able to travel within that region. So essentially, what this means is that there are going to be individual groups of countries which will create these frameworks, and it is likely that these groups will then eventually move on, handshake with the other groups, and it will become more integrated. For example, we know that the EU is now speaking to the North American grouping, especially the US and Canada, to see as to how they can integrate. So, and we also know that the EU is also considering as to how to treat Portugal now, because of their perceived lack of effectiveness in controlling the epidemic pandemic, as it were. So essentially what this means for the Indo-Pacific countries is that we need to see as to how we can utilize a similar framework for us. Admittedly, the Indo-Pacific framework is countries which are very diverse, which are very different, but we are all together in terms of geographical contiguity. So it is possible, and perhaps it's a good idea for us to look at the possibility of exploring a regional collective travel grouping to happen. The second idea that I want to mention for collective intervention is sustainability and responsibility. Because as all of us know, the post-COVID scenario is very, very different from the pre-COVID scenario, because today travelers are going to be a lot more preferential towards sustainable travel practices, towards being eco-friendly and environment-friendly. So essentially what this means is that governments will also channel this. But the cause for the planet and for the environmental concern is not something that needs to be addressed only within the framework of a country. It has to be taken up collectively by several countries and across the globe. And therefore, I think the Indo-Pacific Forum should also look at as to how we can set a framework for achieving better results in terms of environmental and sustainability, and especially in the tourism space, set some targets and see as to how we can move towards that. That will perhaps be the best case scenario. And the third element that I want to mention is of course very critical to enable travel between countries, and that is to guarantee consumer protection and trust. Because essentially today, the biggest deterrent for people taking trips outside, going abroad, is that, for God forbid, if you're not able to take that trip for your own reason or because there is a shutdown, people are not sure as to whether their money is going to come back and whether they will be entitled to a fair settlement. So I think regional groupings can also work towards creating frameworks where we can have consumer protection and we enable trust, which will essentially be very critical for people to start traveling overseas. So that's quickly my intervention.
Thank you. Thank you. I think we got the global perspective or the macro overview from our international people. Then we can move to the Pacific. And as we are the host country, then we come back to the India perspective. So let me go to Miss Inda who heads marketing in Bali Government Tourism Office. In your opinion on what you can share in terms of policy or certain practices that you've been able to execute, Ms. Inda.
Okay, thank you very much, Mr. Punit Chatwal, as our session chair for today. And the other panelists, I am the representative from Bali Tourism Office. Frankly speaking, tourism has played a very important role for Bali economy for decades. Before COVID-19, tourism has had contributed 53% to Bali economy. And then Bali has been completely closed since April last year. And by June 2020, the number of tourists, international tourists visiting Bali dropped sharply to almost 100%. And it also led to the general paralysis of the Bali economy. On this first quarter of 2021, our economic contraction because of this COVID-19 spread is minus 9.85%. This is very difficult for Bali, especially because the emerge of the new variant of Delta. And now Bali is in community activities restriction. So it becomes more difficult for Bali to bounce back. However, we, the government, and as well as the tourism people, the tourism industry, and also the community, has set some strategy. As Mr. Sumandila said, the first important thing is to create the herd immunity in Bali. So the target to create the herd immunity is 70% of the Bali community. And then by 7 July of 2021, for the first phase of vaccine program in Bali, the community that has been vaccinated about 81%, and then the second phase about 25%. We do hope that by the end of July 2021, all of the community in Bali will be vaccinated. And then the second the second strategies we have done is by build a task force. So if we represent it in a diagram, it will be a triangle diagram, which on the top is in the provincial level, the task force. And then in the middle one is the regencies or city level of the COVID-19 task force. And then in the bottom, in the very foundation level, is we call it as Gotong Royong Task Force. Gotong Royong is working together. It's in the level, in the village level, because Bali, the tourism in Bali is kind of cultural and community based. So we ask the community to take part to protect their destination, to be safe, and to be ready to be visited again as the safe international tourist destination. And in this Gotong Royong, or the working together level, in the village level, we have a traditional guardians that we call it as pecalang. So this pecalang is supports or help the police works. They keep reminding people in their environment to wear masks, for example, and to the social to do the social distancing. That is why based on the survey that is done by the Health Ministry of the Republic of Indonesia, the obedience of Bali community is #1 in Indonesia. So 92% of Bali community is very respect the regulation related to COVID-19 code. And then the third one, the strategies, is to implement the CHSA protocols in every tourism facilities in Bali. And to do it, we are supported by the Tourism and Economic Creative Ministry. So we are much helped, we are much supported by the national government, because they do understand Bali is very rely on tourism sector, but you know, COVID-19 has hit Bali tourism and it impacts our economy. And then to cope with this COVID-19 spread, we are also supported by the Health Ministry to develop a tracing and tracking system for the COVID-19 spread. The tracing and tracking system is called as Peduli Lindungi. That is a bahasa Indonesia. When we translate it, means care and protection. So every endpoint here is the tourism facilities should put the QR code of this tracing and tracking system. So the visitors has to scan the QR code when they check in to the facilities, the tourism facilities or other public facilities. And then when they're out, they have to check out. So that is, so when someone, for an example, when they have done a test of COVID-19, and then the laboratories or the hospital has recorded the result. For an example, if they are negative, it will be very good. But when they are positive, when they check into a certain facilities, they will be stopped. They will be forbidden from coming into the tourism facilities. So that is the aim of tracing and tracking system, and it is just launched the 1st July last week. And then also Bali has been chosen by the Indonesia government as the pilot project for the international opening border. So we have chosen 3 areas in Bali that the abbreviation of it is SUN, S-U-N. Those are Sanur, Ubud, and Nusa Dua. So this chosen part is created to be a green zone, to be a safe and healthy as well as comfortable tourist destination. So we are much supported by the national government to prepare these 3 green zones to be ready to be visited by the international tourists. And along with this SUN, Sanur, Ubud, and Nusa Dua area, then we create or we have prepared a guidelines for the international tourists, what they have to do and what they don't, what they are not allowed to do when they visiting Bali. The guidelines we have prepared is aimed to give a safe, enjoyable, and healthy trip in Bali. And this is divided into 4 outlines. The first one, of course, the foreign tourist management in the airport, they have to be vaccinated already. And of course, showing negative result based on PCR tests. And then the second outlines is how the hotels serve them when they arrive in the safe hotel, of course. And then when they arrive in tourism objects, all of these tourism facilities already given ICHSA certificate as a proof that they understand to serve their clients based on health protocols. And then the last one, of course, when the international tourists go back in their country. And the last but not least, Bali entry points also have to be carefully guarded. Every visitor should be able to show vaccine cards, at least phase 1, in the airport and also harbors. And of course, able to show the guards there, the workers there, the negative COVID-19 test result. Because the difficult things for Bali to protect is in the harbors, like Gilimanuk harbors, because we are very close to Java, and Java is in red status now. So we just have to guard this small island very carefully. But frankly speaking, it is not easy for us. And for these last 2 weeks, the cases in Bali is increasing very fast. So last month it is under 2 digits, and now it's already hit 500 more of positive case in Bali. But of course, as Ms. Maribel said, we have to work together, and we have to copy and adapt it what others successful steps and do it in our regions. So, Mr. Punet, that is all.
Thank you, Ms.
Bali.
Thank you.
Thank you very much.
Moving on to the other Pacific panelist from Thailand, Mr. Sirisumpan. If you have also things to share on a tracing and tracking system like Indonesia, or have any pilot, or like Bali, or anything else that you might like to add before we come to India?
Okay, sure. I hope you can hear me, right? So good afternoon to everyone and to the panelists. I try to keep it a little bit short, and everyone could share the idea from our side, from Thailand. Okay. As you know, we have been living with pandemic more than 1 year, and for Thailand, tourism is very important. Is nearly 16 or 17% of our GDPs. So it's really affect the whole countries. So since beginning of the pandemic, and most of the tourism have been stopped, especially the international traveler. So we have started doing some things to maintain the tourism. One is like we boosting the domestic tourism first. We start to concern population on safety protocol. We do the trainings, reskill for all the staff, and then most of activity which cannot be having physical. So everything have to be moved on virtuals, as we know. So that will be some support that we have done. Other parts, okay, which I would like to touch on and to answer Punet's question is that, so for now, we already start to open the countries. We have our roadmap in terms of openings Thailand for international tourists, but it will be done, I think, similar to many countries. It's not totally open, but it will be gradually open very carefully with numbers of measures, right? So once destination we already opened, which is Phuket, that start on the 1st July this year, okay? We call it Phuket Sandbox because it's pilot projects and experiment. So once, if it done well, success, other destination in Thailand will start to gradually open, follow Phuket examples, okay? In doing this, very important, and I think similar to every country, you need a good plans, good cooperations, government, public sectors, nationals, local levels, as well as your partner international like the allies, that you need to fly them in to the countries. And most important is the local people in Phuket. And with same as everyone's is that, and most priority is the consent of the local people. I could share with you that one of the criteria, critical point is that Phuket to be able to open for the international tourists is when the local people in Phuket have been vaccinated more than 70%. Okay, so the number which I could share with you on the 5th of July, 84% of people in Phuket have received their first vaccines. Okay, and 67 already received completed vaccines. Okay, and that is how it has been done to open. But we open with a lot of protocol, many paperwork, many procedures, a lot of COVID tests, tea time. So this is some things that a new normal with, I believe we need to communicate clearly to the tourists, you know, for them to know this is what will be, for them to prepare and what they will see when they arrive at the airport in Phuket. We have done a lot of communications and on the way, you know, arriving, staying, and, you know, before departing. So this is something that very important. I believe some of the tourists still looking at the same old way before the COVID, you know, that the things, you know, thing would be easy to traveling, can go anywhere. But I believe at this transition time, there would be a lot of protocol for safety for everyone, the tourists themselves, the locals, everyone who work in the tourism industries as well. So communication and clear information to give to them is very important. So this is what I'm sharing with you. So we still monitoring Phuket at this moment. So we hope it would be a good example for other destinations in Thailand to coming up as well.
Thank you, sir. Thank you. With that, we come to Ms. Rupinder Barar. And before I hand over to you, I think Mirabel talked about financial and fiscal stimulus. We can feel that there is some fiscal stimulus because we've had some changes in the tourism ministry since last evening. And from the state level, we have got a cabinet level upgrade on the ministry. And then, of course, we are waiting for some financial stimulus, but I let Ms. Barar tell how we can take this sector forward. Over to you, Ms. Barar.
Thank you, Mr. Chitwal. And yes, indeed, it's been a hectic day with the cabinet minister. In fact, to that extent, the ministry finding an elevation because we have a cabinet ranked minister now, and we also have 2 ministers assisting him. And that clearly also shows, therefore, the kind of importance that is being attached to the sector. There is clearly an understanding. In fact, I just came back from his room, and because there are lots of things to be filled in immediately, considering how tough it's been for the sector. So he is very keen to know a lot of details. And I must share with you, the concern is there right at the topmost levels, that as we go forward, and as we've kind of sort of almost come out of phase 2 of the debilitating impact of COVID-19, how are we to open? As you are all aware, in the first phase and post-first phase gradual unlocking that had happened, the emphasis, and that was something globally understood, that it was the nearby travel, the local travel, which was going to open. And so domestic travel is what had started kicking off, and it started kicking off really well. And in preparedness for that, we had come out with the guidelines and protocols way back in June 2020 for all the units to start adhering to those guidelines, which were made in sync with the broader guidelines of the Ministry of Health, and the state governments, the provincial governments all also got together and tweaked them, fine-tuned these guidelines to make sure that the domestic traveler to begin with was safe in traveling. But again, unfortunately, the second wave came and came pretty rough for all of us. And therefore, the steps that we had started taking in terms of creating confidence in actually creating travel had again to be aborted, had to be stopped in tracks, because again, life was to be definitely kept more important. Now again, the question is back before us as to how to unlock, what should be the strategy. The good and the bad part of it is that there is already a learning from last year. So the good part is that some of the systems are already in the pipeline. You don't have to draft new guidelines. You don't need new protocols now. You already know what you need to do. So there is readiness to that extent, and that's what is already witnessed in a gradual opening of some of the locations within the country for the domestic tourist. But again, those have to be baby steps. We understand the level of responsibility required both from the industry as well as the traveler, that if you are not going to respect the protocols, we could be, calling more trouble in the times to come. But what has really changed from last year to now is the vaccination, because last year there was no vaccine available, and now across the world there is vaccination available. And that's going to be the game changer, and that's something as a loud message coming from everywhere, that vaccine, vaccine, vaccine. And I think with India also now picking up pace in terms of at least the first vaccine rolling out really quickly, that's where the confidence building is going to come about. We are in a continuous dialogue with the Ministry of Health and the Ministry of Home in keeping a tab on the percentages, on the numbers and the different parts of the country where vaccination is to be driven. The Secretary of Tourism has already written to all the state governments to prioritize the frontline and the related workers of the tourism and hospitality industry. And we are happy to share that we've got a positive response from almost all state governments, who in turn have written to their health departments to prioritize the workers associated with the industry. So that's a very positive response. Towards that, we are also scheduling a meeting with the state tourism secretaries to be chaired by Secretary Tourism from the Ministry, Government of India at the end of July, where we would be taking forward the vaccination and reiterating the need. And also we shall be working in harmonizing the protocols in terms of what is required, because currently there are some states that are allowing you on an RT-PCR, some we want you to do an RT-PCR on landing. Some do not want you to come with anything. They just want you to walk in. So there is quite a lot of inconsistency currently, but we are just letting them deal with things at their level, and have already sounded that we shall be meeting towards the end of this month to make sure that at least within the country, there is one common protocol so that there is no lack of information for a domestic traveler. In terms of opening globally, as I said, we are keeping ourselves very keenly fine-tuned with the Ministry of Health and Home, and looking at when is it that's going to be the safest, so to say, in the given scenario. Time for us to say, let's welcome back everyone back to India, because we certainly do not want to go through a situation where you open your borders and then after some time you're again looking at saying, no, we open, but hang on, don't come. So we do not want to do that, and we want to open when we are more robust and more sure about ourselves and also the rest of the world. It's good to see that some of our source countries have already got a high rate of vaccination. And so one end at least is met. And the moment our own vaccination also gets a little more in terms of the numbers is when we are looking at opening. We are also in continuous touch with the global media. We are also speaking to our own consultant in a continuous evaluation of how things are panning out, looking at UK, looking at how Delta is panning out, looking at how Lambda is also kind of just surging its head out. So that's the kind of tuning. In terms of messaging, we've had extensive discussions with stakeholders, with media specialists, both from India and outside, that what is the kind of communication strategy that needs to be adopted in times to come? Should it be a more obvious kind of messaging where we say, you know what, these are my protocols and I'm safe? Or is it going to be better for us to be doing a more nuanced and a little more laced kind of a communication, where while we show the incredible India's beautiful products, and within that, the story of being safe as a country is weaved through in a more nuanced manner. So all that content is being prepared. We have the Nidhi and the Sathi portals working with the hospitality industry, making sure not only through Nidhi and Sathi, but through other mechanisms of certifying. So that's happening. There's a lot of dialogue happening. We've also had a dialogue with our 4 major airports, the airports where we expect maximum landing of our international tourists to come in. They are in a state of preparedness. They are ready with the screenings. They are also ready with RT-PCR if it has to be done in a random case where there are symptoms being noticed. They are already having rooms assigned that in case you got to wait for your report, you're not inconvenienced. So that kind of fine work with different elements that are going to be required to ensure that a traveler who does decide to come to India, even in the early phases, feels absolutely secure in making that decision that I am in safe hands and I am really going to be looked after when I come into India. So those are some of the things that we are doing. And if there are any other thoughts or questions, be happy to discuss on this platform. Thanks.
Thank you. Over to you, Deepak. I think it's the right time to bring you in as a veteran of tourism from the Indian subcontinent.
Thank you so much, Puneet, and thank you for inviting me this afternoon. I'm happy to be amongst such distinguished speakers, all of whom have made such interesting points. I'll speak from the India perspective. So, we've had our borders closed since March 2020, have had two waves, one of which was devastating, and we are still recovering from it. Inbound business, which contributed $30 billion to the GDP each year, has vanished, and we have not seen the markets return to this size for some time and will not see them return to this size for some time to come. However, I would like to say that it's not all bad news. Indians are basically optimists, and I think it's time we look at the future with reality and hope. We have been working hard on vaccinating our citizens, and as we go today, we have 360 million people vaccinated. Yeah, there's another billion to go, and speedy vaccination, in my view, is directly proportionate to speedy tourism recovery, and that has also been expressed by the other speakers. Our cases are down to 45,000, and if it stays this way, we should be on our way to opening the country. And I agree with Rupinder, we have to kind of find the right balance between the different ministries and take a sensible decision. Our government needs to decide on the date by when they will open the borders and issue visas. I will leave it to their best judgment, and the private sector should leave it to their best judgment, as many countries have made terrible mistakes by starting and then stopping arrivals, leading to really low consumer confidence, and that is what we don't want. When we do open, we will need to think of what will trigger demand, how the customer is thinking at that time. Is there fear? Is there a trust deficit? Someone spoke of trust. Our communication exercise must address all these concerns. So I would propose to the government to launch an Incredible India 3.0. As you all know, the architect of Incredible India 1.0 was Amitabh Kant. Incredible India 2 was launched by none other than Suman Billa, who is here with us today. He also launched India into the digital market space with great success, and we saw positive results from that initiative, and the numbers in 2018 and 19 really gave the numbers that were expected. So it's I don't know what it is about Kerala officers, but I don't know, Amitabh and Suman both being Kerala cadre officers, there was something that they did incredible. But it's time for us for Incredible India 3.0, and I'd urge Rupinder Barar, who's our ADG, to launch the marketing campaign to bring back guests to India. As the country comes out of the pandemic, it has limited resources, so we must use our funds to go deep and not wide in our demand generation activities. We must therefore use our funds to focus on key markets that have the highest volume and spend immense amount. They spend time and money in India and will give us immediate results. UK, Germany, France, Russia, Japan. These are the five. You may wonder why I am not saying USA, because in my view, USA is still some time away for coming to India, because people are going to be a little hesitant of sitting on a flight for 16 hours. 300 people. Maybe I'm wrong. I hope I'm wrong. We must have a strong digital presence and ensure that the message of reassurance is driven home. Earlier speakers have also spoken about reassurance. The 500,000 free visas are an excellent move by the ministry, and I'd like to compliment Rupinder and the team for their efforts in making this happen. We need to stop constant bad news about India, for which we must hire a professional marketing and PR company and set the narrative right. Every country is standing on the same start line and waiting to dash those 100 meters. The question is, who will take off first and ensure that they hit the finishing line below 10 seconds. Part of this strategy.
Deepak, if I may interrupt you here, you just now said about 500,000 visas. At the same time, you said the country's travel is shut since March 2020. Who are you going to issue these visas to and when?
The borders are going.
Because when I read it, the visas are only limited. 3 visas are limited till March of next year.
So I'll let Rupinder answer that question, but if the borders open in October, you will have 6 months of high season for people to travel. I would imagine that even if 1.5 million people travel to India in 6 months, or 1.5 million, 500,000 of those could be the first free visa. So it would, yes, you're right, it's directly proportionate to when the borders open. But I think, Puneet, what is also important is to plan the strategy, and I would like to make just one more point, if it's okay with you. And we can circle back to your, you can ask the question to Rupinder, because, she would be best to answer that. See, one of the things that our strategy must involve is the Indian embassies in each of these countries, and the ambassadors have to be responsible for the recovery of tourism. If they can help grow investment in the economy, industry, exports, why can't they focus on tourism? In fact, we must start engaging with them now so that we can start planning a crucial tourism-related confidence building measure that seek to reassure travelers that India is safe to travel to. In fact, I would go as far as to say that if we want these CBMs to really work, they should be based on a clear plan, a strategy, and that is jointly owned by tourism, external affairs, and health. This is very important. As I've said before, our tourist offices are an idea of the past and are irrelevant and have no role to play in the future. We must look at this all over again. This is a great opportunity. So, with that, I've been speaking to many customers. Guests are looking at long haul in early 2020. The period from now to December will have some traffic if borders open. UK just announced that you don't have to go into quarantine if you come from an amber country. Positive press would help. And 2019, which was our best year, if we get everything back by 2024 from an international market point, I think we would have done a lot. So yeah, I would recommend to the government, no quarantine, no PCR test if they have had 2 vaccines. PCR test if they don't have a vaccine. Let them travel free and easy. So that's what is the way to bring business back, and that's I'd like to leave it on an optimistic note that things will definitely come back. Travel has to be smooth, hassle-free, and without complications. So I expect that business will come back. It will come back real strong, but it has to be an effort by industry and the government to bring it back and make it simple for people. So that's thank you very much for giving.
So let's say a very short answer from our global people, Maribel, and then again same order, Sumant. What would be your most preferred and recommended, just one game changer that will help countries revive tourism in the best way? Just one thought.
Well, coordination for once, no? I mean, for us, the most important is the harmonization. That is a game changer. Is to be aligned for the same, 10.4% of the GDP of the global, global economic level. So for us, that's the game changer, to be all aligned for the same purpose, which is a little bit complicated, but coming to the conversation, you were discussing about, PCR, test, vaccination, which is clear is we need a platform that indicates who is vaccinated, who has a test, and that is nothing to do with countries, it's to do with people. Countries are not the guilty, people, it's not even guilty, it's if you are contaminated or not, it's an individual situation, it's making visible the invisible. So countries should be, the focus is people. So it's why it's quite important to have this international coordination, to have a unique platform. And this unique platform is going to be bringing us this information. This is going to be very complicated. We all know that. That's why we are suggesting bilateral agreements, regional agreements. Is the only way to get to that global agreement. It will take time, but should be and copy and just do whatever what the ones that are doing in a good way. Just copy. We don't have to reinvent the wheel twice. You know, if Europeans are already doing something, use that something. Of course, customize to your region, but needs to be a very easy way to communicate, and that's the only thing. Harmonization.
Thank you, Suman.
I think two things. The first is, of course,
only one, please.
Yeah. So, the first she has already said, which is global coordination to enable people to travel overseas. The second is health protocols at the destination to assure travelers that they are safe when they travel.
Thank you. Our
Mr. Chatwal, if I may come in,
yes.
We still have one speaker left in case.
That's Mr. Nabil. Yes.
That's right. That's right.
Thank you.
Yeah.
Mr. Nabil Sultan from Emirates, I think very important in this conversation would be one region that has been getting tourists, one region that has been getting the business and corporate travel is the Middle East, and the Middle East is unimaginable without the Emirates. As you belong to that group, it would be nice if you could share with us your thoughts.
Well, I mean, thank you for first giving us the opportunity. We really appreciate it, Mr. Chatwal. I think, look, I mean, India and UAE have long ties, and especially I think the Gulf states. There is definitely a tourism that has been there for centuries, and I think we've had massive tourism going into India, whether it be medical tourism and various other sort of sectors. And I think, one of the things that could probably be looked at is this, creating this bubble travel between countries where you think that, these countries are safe, they have reached a high level of vaccination, and therefore, these sort of bubble needs to be established to sort of get a movement going between the two cities or two countries to ensure that travel restriction is no longer there. So I think initiatives like that, I'm sure, will help quite dramatically in terms of getting a lot of the GCC nationals here to sort of travel and come to India for tourism.
Thank you. With that, I think, is there anything that you would say which you foresee as a very important step, that you might have taken that is attracting so many people to Dubai and so much business in and out of Dubai? It stands out on the global map.
Well, I think, as I said, I think there are various factors that one needs to sort of look at. And I think, we need to obviously, from an airline perspective today, I think it's absolutely critical and crucial to reinstate at least the traffic right for a lot of the airline, not just us, but I think it's essential, because I think one element that needs to be understood that, the airlines have suspended operation for almost 1.5 years, and for us to reinstate the capacity back in there is a tall order of work, and of course, we have to retrain a lot of our pilots to start operating again. So there's a huge work that is still needed to happen. So to, obviously, the sooner these traffic rights are reinstated, at least the airline then can start preparing to ensure that as and when the country opens up, you're almost ready to start operating almost immediately. Of course, an airline like Emirates, we operate almost 130 flights to India. This was pre-COVID-19. Almost connecting almost about 150 destinations to 9 cities in India. So you could imagine this isn't just about Gulf traffic going in there, but it's actually bringing almost global tourism into India and out of India. And I think there's a massive capacity that's being deployed. And I think from an airline perspective, I think the sooner we have the indications and then the traffic rights reinstated, it just gives us the confidence to go back and make those investments, especially I think at times like this where airline probably are the the largest hit when it comes to the COVID-19 sort of impact. And therefore, at times like this, it's difficult for airlines to invest, put in the money without knowing that, okay, there's assurance, at least from the government, that they have reinstated these traffic rights. And that probably gives us the confidence to go back in there and prepare ourselves, for as and when the country is open for tourism and travel.
Thank you. Mrs. Inda and Mr. Sirisumpan, in that order, how do you think Indonesia and Thailand are dealing, before we come to India, in helping grant traffic rights and opening up, for the airlines? Is there something planned, or is it still too early? We have to wait, or some discussions are going on?
For Bali, I think the rights to the international border is in the central government in Jakarta. Actually, we in Bali, we think that we are ready already. We are ready to welcome the international tourists, and I do think looking at the regulation now, it's a little bit complicated for tourists to come to Bali. So we want it a simple way. When they are already vaccinated and already saw the negative result test based on PCR, they do not have to be quarantined. I think that now the Foreign Affairs Ministry is preparing to make a travel bubble with the Singapore and United Emirates Arab. We just wait for that to happen. So
Okay.
in Bali,
so you are in the waiting mode. What about Thailand, Mr. Sirisumpan? Are you also in the similar state, or are you advanced?
All right, okay, just to add up on that, in terms of the overall national policy, I think now safety is become very important. Looking at overall, I think now the challenge of the government is how to balance between safety and the economy part. But I believe this have to depend on the situations. For Thailand now, I have to admit, it's still up and down for the COVID situations. So things have to be adapt and changing to the situation as well. I'm talking back on Phuket. Now we did allow the tourists to come in without quarantines, but they have to be vaccinated already, and it starts from some low and medium risk countries. Airlines like the Emirates already fly in some of the tourists from Europe and Middle East to Thailand as well. Last but not least, again, I just want to touch on that most important thing that we could work together is part of the communications. Us have to send out the positive energies, about tourism. So at least this thing will help us moving forward together. And also, once things getting better, I think the cooperations between countries together with the supportive of like WTTC and World Tourism Organization would help in terms of like standardize and giving guidelines for coordinations of overall, because now it seems like every country is looking more individual in terms of protecting and safety. Everyone will have their own protocol, but probably it's coming future there would be something in common ground together. Thank you very much.
Thank you, sir. Thank you. I think you said something very good about the balance between safety and economy. At CII, we also call it, protecting lives and livelihoods. And I think that's a dilemma most of the governments have. In one hand, there is a situation on protection. On the other hand, there is an economical disaster out there because of all the loss in the livelihoods. With that, I would, really ask Ms. Barad to throw some light on any kind of plans that we look forward to help support, revive, the domestic tourism at least to begin with. And if there is any visibility on when you feel that international tourism might open doors back into India.
So Puneet, on the domestic part, as I already mentioned, when the first phase had started to abate, we started with a lot of events around, and the ministry and the local state governments also took on themselves. In fact, we had the first largest physical event in Kevadia in February, where 400 domestic tour operators actually came in physical presence, and there were lots and lots of people who joined in along with these 400. So I think the entire contingent eventually, including the media and everyone, was almost close to 500 people. And they spent 2 nights over there, and things looked good. But it was entirely a ministry supported event. So those kind of events carried on. We went to Khajuraho in March again to inaugurate the new convention center. That again was an event that had close to 500 odd people. We then went to Srinagar to promote Srinagar as luxury tourism and also as a place which is such a beautiful part of our country. So we had a whole day of golf. The other day we had cuisine, we had celebrity chefs. We had a lot of discussions on how to take forward the light and sound show, which has been created. So lots of stuff had started happening around domestic. A lot of hotels were registering occupancy right up to 30th June. That's another matter that COVID struck us again, and those had to be cancelled. But the demand at the domestic level has been resurging back, and we are looking forward to that resurgence in the next few weeks again actually happening. And the government has been stepping in, and we shall continue with our physical events. We are hoping to do one in Leh. We are going to do one in conjunction with our associations, and I would say every fortnight or every once a month in different parts of the country, so that there is a momentum, there's a confidence. And the idea then also was that if we as a government are going to go out and do these events, it sends out a huge positive message that if it's safe for me, it's safe for you. So that was the overarching theme and concept of doing those physical events. They shall be coming back with gusto very soon. And in terms of the global part of it, partly answering also what you said about the 500,000 visas. Yes, in a sense, it seems like an early announcement, but it's an announcement of intent. That as and when because it takes a little while to actually enable the softwares. So we don't want to be in a situation when we are ready to open and we don't have the softwares in place. So the Ministry of Home, which actually issues the e-visas, is going to make sure the system is in place, the consulates and everyone around the world is communicated. And the moment the first tourist actually uploads the application, and then when he puts up for the fee and it says, no, you are a welcome visitor, you are not to pay the fee. And again, in that, it's not the $25 which is crucial, but it's the intent. And that's the idea behind this messaging. And as to when will it open? Finger toes, body cross. Let's hope that things go as they are going and the gradual phasing away of the pandemic remains. But for me, if you ask me that one thing which is going to be the game changer, it's vaccine, vaccine, vaccine. And that's why the focus of the government is on making sure that the ground level delivery of the vaccine in a country as large as India remains robust and the supplies remain robust. And I remarked it in the beginning, and I must reiterate that the highest levels of the government are extremely, extremely conscious of the role of the health ministry at the center, as well as of the state governments to work in conjunction with each other. That's why the central government has also stepped in, making sure that the supplies are not dried out. So there's lots happening, and let's keep our fingers crossed on that there will be a larger corpus of people who are double vaccinated. But in the meantime, we want to be in preparedness, and that's why the visa announcements, the preparations at the airports, the content, the strategy for global media campaigns, everything is just locked in the closet, waiting for things to unfold and waiting for all our friends from overseas to come and be with us once again.
I think very excellently put that was that the free visas is the expression of an intent And I think the intent builds the trust and faith and also prepares the nation. So I think very, very well said on that. With that, I think let's go around and have one last word from each of our panelists. This time we will start the other way around from Mr. Nabil Sultan and then Deepak. Mr. Sultan, one last word from you.
I mean, I just like to say that, look, as a major international long-haul airline, Emirates remains confident in the recovery of international tourism demand, of course, facilitated by air travel, with the industry currently experiencing, of course, an exceptional surge in travel booking this summer. We have seen that already, that, when we've actually opened destination and we've made travel easy. And again, this is not to say that, we will compromise the safety and the health of the nations, but it's actually by putting the right measures in place and ensuring that, we still take the necessary precautions, whether be it in form of, handling people who've been vaccinated and making their travel easy. And for those who are not actually been vaccinated, what sort of measures can we sort of put together in agreement with governments, airports, airlines, almost working together and ensuring that we have proper SOPs, that is facilitated to make travel much more easier. And I think we have administered that once these measures are put in place, these destinations are open. I think most of us have concurred that we have seen huge rebound in travel almost instantly. So there is definitely a huge pending demand awaiting for a lot of these countries to open across the globe. We've seen evidence of that recently with Italy, Spain, France opening up. And we've seen that most of the flights that we have put in immediately were full. We've had very high seat factor operating to these destinations. And again, we've made sure that there is proper measures in place to ensure that the safety of the passenger, of the crew going to these countries is well sort of addressed and taken care of. So I guess with that in mind, I would really encourage all governments, and of course India is one great nation, and I'm sure they have huge benefit to offer in terms of tourism, and I'm sure a lot of people are looking forward to sort of travel there. And I really hope that we're able to sort of put in place certain measures to allow tourism into India as soon as it is possible. Thank you very much.
Thank you, sir. Thank you, Deepak. We heard from Bhupinder Banerjee about the intent, and you mentioned about international marketing. I think you can also support some domestic.
No,
what you have to say.
No, I think I think Rupinder answered the question regarding the visas extremely well, and the intent, yes, but also consumption of these visas will not be a problem. I can be sure of that, even if the borders open on 1st January. And I would like to also at this stage compliment the government for being proactive. We are always asking for things and then we say nothing gets done. Here is a government that said 500,000 visas as and when we open, they're all for you. And I think that is also an intent which I appreciate. So great stuff. Thank you, Rupinder, for that. For me, it's easy entry for vaccinated people. Build a great campaign, Incredible India 3.0, do it right, create amazing content. We have amazing product, including the small hotels that Indian hotels have now. These are products that need to be created and taken out into the marketplace, but open only when you are ready. I would not, and I should not be saying that you just start up next. I'd love to see the borders opening next week. We're not ready. Let's do it right. Let's get it right, and then build from there and be the market leaders in this region.
Suman, for one last comment, and Suman, are you there?
Suman, you're muted.
Yeah, okay, got it. So I think the situation is this, that we are in a bad place. But I think we need to look at it from the perspective of it also gives us a great opportunity to hit the reset button. If we are able to get our game right now, I think we will be able to build tourism on a much more strong and robust basis than we've ever done before. And as all of us know, in all these 60, 70 years that tourism has done in India, our capitalization is very small. And I think this is one opportunity for us to get our game right. And I think we will be able to come out much stronger.
Thank you. Thank you very much. Thank you to all the panelists. I think we've ran over time by 5 or 6 minutes, but we started also 2 minutes late. So thank you. Enjoyed the open discussion and wishing our sector a good survival, a speedy revival, and a sustainable thrival. So,
Well said.
thank you very much for joining.
And also, congratulations to you for bringing India up on the best hotel in the world. So, under your leadership, the Taj is today considered the best hotel chain in the world. So, congratulations to you to end that.
Thank you very much. Thank you, everyone.
Thank you.
Thank you, Mr. Chatwal.
Thank you.
Bye.
Sorry, everyone, for
Bye,
that
Mr. Chatwal.
minor glitch that happened in the beginning of the session. But I thank you all for being here. Today is the last day of the Indo-Pacific Summit, which has been organized by the Ministry of External Affairs, Economic Policy Division, and the Confederation of Indian Industry. Thank you very much for being with us. Thank you, Mr. Chatwal, for an
Thank you very
excellent
much.
session.
Thank you.
Thank you.
Thanks.
Thank you very much, everybody.
Bye.
Thank you.